Hello, everyone. Today we talk about the types of non-adherence and reasons why people do not adhere. Now, if we speak about this particular topic, or rather say this particular section comes under the heading adherence to medical advices. And when we speak about adherence to medical advices, this is the second unit or the second chapter that we study under health psychology. To remind you all, our syllabus comprises of four different components. Amongst those four different components, you're expected to study any two. Now, if we speak about health psychology, the component health psychology is divided into five different units or five different chapters. Amongst those five different chapters or units, adherence to medical advice is the second unit. However, every unit is divided into three further sections or three further divisions. And this topic that we're studying today, that is types of non-adherence and reasons why patients do not adhere, is the first section from the chapter adherence to medical advice. Now, as we take this ahead, let's talk about what the term adherence over here means or what the term adherence over here refers to. Now, a common sensual understanding, the term adherence refers to obeying. The term adherence refers to obeying. And of course, when adherence refers to obeying, non-adherence would refer to not obeying. So if adherence is obeying, non-adherence is not obeying. Not obeying. Now, taking this ahead, these are the three different sections that I was talking about. This is the name of the unit or the chapter that I've highlighted in green. What you see in front of you is a screenshot of the syllabus to minimize human error, to minimize chances of any mistakes. So these are the three particular sections. Let me just mark them all for you. 1, 2, and 3. Now, each section is further divided into different topics. Now, these bullets that you see over here, for every bullet that you come across from your syllabus, expect a 6-mark question from this, right? As you all know, each unit is divided into three sections, and each unit comprises of a key study. This is the key study that I've highlighted over here in purple, that is right towards the end. Now, taking this ahead. So what I'd said about adherence was, adherence typically, as we know of it, is when we talk about adherence has to do with the extent to which we obey, right? Now, adherence has been defined by the World Health Organization, that is WHO as well. Having a look at what WHO has to say about adherence. According to WHO, adherence is the degree to which the person's behavior corresponds with the agreed recommendation for a healthcare provider. Now, when we speak about this definition of adherence that was put forward by WHO, the general understanding or the understanding that we should have from this is the degree to which an individual, that is a patient, does accept and follow the recommended advice or the prescription that he or she has been advised by the health practitioner. Or, in other words, the extent to which we end up following what the doctors ask us to do. Now, this is how we define what adherence is. As we know of adherence, we should also know of non-adherence, like I had mentioned a minute back. Non-adherence has to do with not obeying. Now, this non-adherence could be broadly put into two different categories. To begin with, failure to follow treatment. Now, I'm sorry, failure to follow treatment. As we speak about failure to follow treatment, the idea over here is when us or when a particular patient is not really able to follow the treatment that has been prescribed to him or her. Could be because of any reason, could be rational or could be without rationality. This has a lot to do with the perception that that particular patient holds about the health services, about the symptoms, about the illness, about the severity of the symptoms, so on and so forth. And the second one over here is failure to attend appointments. So what I'm trying to explain you over here is non-adherence. Non-adherence could be broadly put into two main categories, and they are: number one, failure to follow treatment; number two, failure to attend an appointment. You do realize how non-adherence could have very serious consequences. For instance, if a patient is not adhering to the advice that has been given to him or her by the practitioner, that could result in the severity of symptoms, that could result in that particular disease or that particular illness that the patient is encountering or experiencing worsening up, right? So non-adherence could have serious consequences to both types of non-adherence, that is this one and this one, both for the individual as well as for the wider society as well. That applies well for the health related services as well. So if you're not following a treatment, that in other words means the illness would get worsened up, and eventually when you do realize that things are have worsened up, things might go out of control, which might as well result in the person losing his or her life as well. Number two, failure to attend appointments. If you are not attending appointments, if you're not going to visit the doctor when you're actually supposed to go and visit the doctor, that could have a negative impact on the health services as well. Because guess what? If you have a time schedule, if you have an appointment schedule, and if you're not attending that particular appointment, you're, in other words, letting the doctor, letting the practitioner, you're actually wasting the practitioner's time as well. And the time that you wasted over here could have been put to use to maybe help another patient. So these are the two basics that I'd wanted everyone to keep in mind. Number one, failure to follow treatment. Number two, failure to attend appointments. Now we've studied all both of them under the heading types of non-adherence. Taking this a step further, this was the first one, if you remember, and this is the second one. Failure to follow treatment could again be broadly put into three main categories. To name them, we have primary non-adherence. We speak about what they are and how do they differ from each other on the next slide. So failure to follow treatment could be broadly put into three categories. Number one, primary non-adherence. Number two, non-persistence. Number three, non-conforming, right? However, failure to attend appointment could again be put into further categories, such as if you're not attending the appointment, you are wasting medication. That could waste medication. Number two, that it's been time lost to missed appointment. Number three, progression of illness. The illness might get worsened up. Number four, increased use of medical resources. You are misusing the medical resources. Number five, reduced functional abilities. Number six, lower quality of life. Number seven, impact of medical research or the impact on medical research. Now, these three categories, I'd first want to discuss these three, and then we'd move on to discuss the latter part. So when we speak about failure to follow treatment, like I said, we'd initially discuss what primary non-adherence is. So as we use the term primary non-adherence, this happens when a doctor prescribes a medication, but the patient doesn't even bother to pick up that prescription, meaning they do not get the prescribed medication, which would eventually mean if you're not collecting your medicine, you're not consuming it. If you're not consuming it, you might not get better. First one. Number two, non-persistence. This occurs when a patient starts taking medication but stops without being told to do so by the doctor. Now, when a patient is prescribed, goes, collects medicine, starts taking medicine, but ends or stops taking medicine before he or she has been asked to stop taking medicine. This could either be unintentional and can result from communication issues or a communication failure with the doctor, or this could be because of the difficulties in following the treatment plan. Now, what sort of difficulties are we referring to over here? Cost could be one. Number two, access problems. Accessibility could be an issue. For instance, if let's just say you have commuting issues and the prescription that and the surgery or the medical clinic that you want to visit is far away, that could, or the medical procedure that has been advised to you is far away, that could end up being problematic for you as well. Number three, it could be because of forgetfulness, right? Now forgetfulness could be genuine forgetfulness, or forgetfulness could be because you probably did not take the practitioner seriously. So, intentional non adherence is less common but may occur due to the patient's beliefs. Now, the patient's beliefs over here matter as well. For instance, if the patient believes that the medicines that have been prescribed to him or her might not really be really helpful, or the patient believes that or the patient believes that the medicines aren't severe enough, or sorry, the symptoms aren't severe enough that a proper medication needs to be taken place. That could be a reason as well. Number two, the attitude. Number three, the level of motivation, how motivated they are to fix their health related issues. Number three, the third category that we delve into right now is non-conforming. Now, what do I mean when I use the word not non-conforming over here? Non-conforming refers to ways in which medication is not taken as directed. So, probably you are taking medicines, but you are not really taking medicines, or you're not really adhering to the advice that was given to you by the practitioner the way you're supposed to, such as missing doses. This could be one factor, taking medication at the wrong time or in wrong amounts. Now, I hope everyone by now is able to differentiate between three different types of non-adherence that come under the heading failure to follow treatment. Remember, the first one is primary non-adherence. The second one that we spoke about right now is non-persistence. And the third one we spoke about is non-conforming. Taking this ahead, according to the WHO, World Health Organization, the percentage of people not following the prescribed treatment differs a lot in various studies. So, what we understand from this is there have been various studies that have been conducted, and we found out that the percentage of people that are not following their prescribed medicines, they have a lot of variations amongst them, right? Ranging from 10% to 92%. 10% is, of course, if you talk about a comparison over here, if you talk about the differences amongst individuals, it's a huge range between 10% to 92%. In 2002, the World Health Organization reviewed this and found that around 50% of people in developed countries don't stick to the prescribed medication. So, if 50% of individuals, being specific, from developed parts of the world, they are not sticking to the prescribed medication, how do you expect to get well? How do you expect? I mean, the practitioner can, if the practitioner is trying to help you based on his or her medical knowledge, based on his or her experience, but a practitioner is not really a magician. So if you're not adhering to the advice that has been given to you, if you're not sticking to the prescription that has been given to you, you cannot really expect to get fine or to get 100% healthy. Now, about half of this lack of adherence is on purpose when you're doing it deliberately, and it is more common with long-term health conditions compared to short-term ones. So, what we should understand from here is, if you talk about a comparison, if you're talking about a comparison between long-term medical illnesses and short-term medical illnesses, for long-term medical illnesses, the non-adherence that we learn from this is high as compared to short-term illnesses. We're talking about a comparison between non-adherence. So, in other words, if there is a long-term health condition, if someone has diabetes or if someone has a chronic illness, the likelihood, or in other words, if that particular state or if that particular condition has been there for long, the likelihood of the patient not adhering is higher as compared to a short-term medical condition. So I hope this has been understood so far. If yes, let's move on and talk about failure to attend appointment. Let me take you back so that you know what actually are we dealing with. So we talk about failure to attend appointment now. Now, as we speak about failure to attend appointment, non-attendance for scheduled appointment poses an additional concern. Of course, it is a concern, with rates of non-adherence at primary care facilities, specifically general practitioner offices, reported to range between 2.9% to 11.7% in the UK. However, in the US, it is 5% to 55%. So what we learn from this is, and they both develop parts of the world, according to what we have in front of us, we're talking about the difference between the extent to which individuals do not attend their scheduled appointments, right? So for UK, it is between 2.9% goes all the way to 11.7%. However, for US, it is more, it ranges between 5% to around 55%. So this is the comparison that we were talking about over here. Taking this ahead, there are certain problems that have been caused by non-adherence too. Now, these problems, I had mentioned all of them over here on this slide. These are the problems that we'd be discussing briefly now. Now, as we speak about the problems that have been caused by non adherence, to begin with, wasting medicine. If medication is received but not taken, it leads to significant economic consequences and potential issues with supply and demand. So, if you're collecting your medicine and you're or if you're purchasing your medicine and you're not even putting to use, don't you think that is a selfish act? The medicine that you're choosing to waste and not consume could have been used for someone who who had a similar illness, and this eventually could lead to issues in terms of demand and supply, right? One. Number two, demand and supply of medicines. Number two, time lost due to missed appointments. In the UK, research from the Doctor Patient Partnership and Institute of Healthcare Management in the 2000 showed that 17 million GP appointments and 5.5 million practice nurse appointments were missed, costing an estimate of 150 million pounds. That's quite a number. So, what we are talking about is the time being lost of the practitioners of the healthcare facility due to appointments being missed. Now, not only is the time being lost, but this time along with it consequently leads to a lot of financial loss as well. Because, of course, if you are not visiting if you're not visiting the doctor or the practitioner when you're supposed to, the doctor's time gets wasted. The doctor's time gets wasted, for which the government, the health department, has been paying the doctor for. So, taking this ahead, according to the research from the Doctor Patient Partnership and Institute of Healthcare Management in 2000, this showed that 17 million general practitioner appointments and 5.5 million practice nurse appointments were missed. And this had a cost to it that is 150 million pounds. Taking this ahead, moving on to the third problem that has been caused by non adherence, and that is progression of illness. Not taking prescribed medicines can result in the worsening of an appointment that I had mentioned earlier. The worsening of an illness, potentially leading to hospitalization or the need for stronger and more invasive treatment in the long run, could lead to the person losing his or her life as well. Number four, increased use of medical resources. Untreated conditions may escalate, right? If you're not treating a particular illness timely, that might result in an escalation of your severity of that particular illness, which might require hospital visits, admissions, and stays in nursing homes. And all of this, not only does this affect your health, but along with that, this affects the budget. This affects this affects the the budget or the finances. This affects the medical system financially as well, because all of this has a cost, right? All of this has a cost, and there's a cost that the government bears for this. So we are discussing problems that have been caused by non-adherence. To begin with, we spoke about waste of medication. Number two, time lost due to missed appointments. Number three, we spoke about progression of illness. Number four, we spoke about increased use of medical resources. The fifth in line, reduced functional ability. Neglecting a treatment for a disease or condition can impair a person's ability to function properly, potentially affecting their work and daily activities to be affected as well. So, if you're neglecting a treatment, eventually it's going to come back to you. Eventually, you might result in not being able to function or not being able to live your life the way you'd wanted it to. Number six, reduced. Oh, there's a mistake over here. So, untreatment medical conditions can not only worsen symptoms but also diminish the overall quality. So, this can diminish the overall quality of life for the patient, continuing to decline until proper treatment is followed. So, what we should learn from here is that your quality of life gets affected as well. The seventh point, a negative impact on medical research. Incomplete treatment courses hinder researches. Now, let's just say there's a new medicine that has been there's this new, that is being launched, and initially it's going through its testing phase. Do you realize, if you are a part of the sample that is being researched on, and if you start taking medicines and stop them midway, this could result in this could result in an incorrect feedback, right? How could someone know about the efficacy or the effectiveness of a particular medicine when the people who consumed it did not even do justice to it, right? So impact on medical research. Incomplete treatment courses hinder researchers attempting to assess the effectiveness of medications for specific populations, slowing down progress in medical research. So not only are you negatively affecting yourself, but you're negatively affecting others as well. As evident, the adverse consequences are substantial and far reaching, impacting not only the individual, but also carrying financial implications for the medical services. So we just spoke about this. We just spoke about failure to follow treatment, and we spoke about failure to attend appointment, and both of these, they are different types of non-adherence. Taking this a step further, let's move on and speak about and discuss this example study that was conducted by Laba et al. In the year 2012. Now, this study, I'm referring to this as an example study. What do I mean when I use the term example study over here? If you Let me just take you back to the syllabus. Now, if I speak about how a syllabus is designed for every particular unit, you have a few example studies. I'll just clean this so that you know what I want you to focus on now. So for every unit or for every chapter, there is one key study that I'm highlighting over here in purple. So this is the study that you need to focus on the most, right? Number two, for every particular unit, there are a couple of example studies. Now, this is an example study. Laba et al. We have another example study over here that is conducted by that was conducted by Reichert and Roter, the third one by Chung and Naya. And then we have this another example study conducted by Cheney et al. Now, number one here, number two, Reichert and Roter, number three, Chung and Naya, number four, Cheney et al. Here you go. So what I've highlighted over here is an example study. So what I've highlighted over here is an example study. What I've highlighted over here in yellow is an example study. What I've highlighted over here in purple is an example of a key study. Now, both the example studies and the key study they're specified in the syllabus. If they've been specified in the syllabus, you might get a direct question on this, right? Now, is this it that we all need to know, or is this it that we all need to be aware of? Uh, Actually, no. Along with key studies, you need to know the example studies. Along with example studies, you also need to additionally know reference studies. Now, I am naming it as a reference study because these are the studies that you cannot really be directly questioned on. You will not be directly questioned on the reference studies. However, there's a possibility that, however, you could always put them to use while evaluating. You could always put them to use for better evaluations, or in some cases for description of a particular answer as well. So uh, key studies and example studies are the studies that you can get directly questioned on. This is the example study that we speak about right now. So this example study by Laba et al. Let's begin. Now, this example study by Laba et al. Or et al., this was to test or to investigate rational non-adherence. This was to investigate rational non-adherence. Rational non-adherence. Now, as the name in itself suggests, non-adherence is not obeying, and rational non-adherence is when you have a when you have an apparently rational reason or a justification as to why you're not adhering to the medical advices. Now, there are several factors that play their role when it comes to rationally not adhering. I mean, this of course has a lot to do with the attitude you're carrying about yourself, about your health, about the healthcare system. And this could be because of side effects, and there are multiple other factors as well. So when I use the word rational non-adherence, what I actually mean is when an individual is not adhering, but he or she provides a apparently rational justification as to why that particular individual is not adhering to the medical advice. So, Laba et al. Conducted research to identify the primary factors. Now, what is this research about? We're trying to identify primary factors that influence rational non adherence. The study aimed to explore whether non-adherence is influenced by factors related to specific medicines and patient's background. So, specific medicines and patients' backgrounds, this is what we're trying to test. An online sample system was employed to gather data from a representative sample of 161 Australian participants. So, the sample comprised of 161 Australian participants over here. The sample was diverse, covering various age groups, genders, education levels, and income ranges. So we have a pretty decent sample over here, a sample that comprises of 161 Australian participants. This sample was gathered through an online sampling system. It was a diverse sample, diverse in terms of the age groups they belong to, their gender, their education level, as well as their income ranges. Now, what is this study about? Again, we're trying to, Laba et al., they were trying to identify primary factors that influence rational non-adherence. Taking this ahead, they used an online survey with three parts. There are three parts that we speak about over here, this being the first part, this being the second part, and then we'd speak about the third part. The first part asked about the current medication use and thought on the medication. So the participants were asked what medications were they using currently and what were their thoughts about that medication, right? Do not miss on this part as well. Taking this ahead, the second part involved a discrete choice experiment with 10 imaginary or hypothetical situations. In these situations, participants imagined taking two different medications for long term conditions. They had to choose which medication they would prefer to keep taking in each scenario. So, this second part over here involved or it comprised of hypothetical questions. There were 10 hypothetical conditions, and the participants were asked to imagine taking two different medications for long term conditions. And they were also asked amongst those two medications which medicine would they prefer taking in terms which medicine would they prefer taking. Now the third part over here collected background information about the participants, that is demographic details maybe. Now I assume you know what the aim of the study is. I assume you know what the sampling comprised of, or the sampling technique and the sample demographic comprised of. And I'd like to assume you all do have an idea about the about the general outline of the procedure for this particular study. So for each medication, the participants would be given information regarding the following factors, right? For each medication, remember there were this, yeah, this is what we're talking about. Here you go. So the first one, symptom severity. Number two, symptom frequency while on the medication. Number three, the chance of early death from the illness while on the medication, which of course is for many would be a worrying factor or a concerning factor, and a justifiably concerning factor. The fourth one, the severity of the medication side effects. The fifth one, the change of future unwanted medication side effects. Now there are some medications that have a side effect that you experience right away. There are other medicines that might not apparently have an immediate effect on you, but in the longer run they could be potentially dangerous. Number six, how the medication is taken. Number seven, alcohol restriction. Number eight, the monthly cost to you of the medications. Now, taking this information, taking this ahead, the purpose was to identify the most important factor or the most significant factor influencing medication non-adherence. A total of 32 choice sets were created, divided into 4 survey versions. Additionally, a repeated choice set was included to ensure consistency and rationality in decision making. Having a look at the results real quick. Now, if we move on and discuss the results here and talk about the factors that affected medication adherence. Number one, results indicated that 6 of the 8 factors significantly affected or influenced the decisions to continue medication. Now, the 2 factors that did not make a difference were these: symptom severity and alcohol restriction. So these 2 factors, that is the first and the seventh factor, did not make much of a difference. Besides these 2 factors, the other 6 did have an impact. Now, moving on, Participants' background and medication use. Participants' background characteristics and current medication use did not significantly alter the effect of influencing medication. Another important piece of information, so your background and the current medication you were taking did not significantly affect or did not significantly alter the effect of influencing factors. Number three, monthly medication cost and insurance influence. Of course, monthly medication costs emerged as a significant factor in non adherence, but this was seen in individuals who did not have any private insurance or individuals without private insurance. For them, of course, uh, the cost would be a major factor. Insurance coverage mitigated the impact of medication cost on adherence, or in other words, if there was insurance coverage that the participant or the patient did have, it didn't really affect their it didn't really it wasn't really an important or significant factor that would affect their adherence levels. Now, trade-offs in decision making. Analysis revealed participants willing to trade between different levels of factors. For instance, participants preferred once daily medication over four times daily, right? If you asked to take a medication once compared to you being asked to take a medication four times a day, it was seen that in cases where the patient was advised to take the medication once a day was adhered to more as compared to uh, a patient being advised to take a medication four times a day. But the latter was acceptable. That is the latter. What is latter over here? The four-time daily option. This was this was again acceptable only if the future side effects were reduced by 20%, right? If the future side effects were reduced by 20%, yes, uh patients did not even mind taking medicines four times a day. The next one over here, priority on harms over benefit. A majority of participants prioritize avoiding harm over gaining benefit. So when you're taking medicine, you're trying to gain a benefit out of it, right? But all of these medications, they do have a side effect. So for 58% of participants, they prioritize avoiding harm over gaining benefits when deciding on medication adherence. The next one, weight of current and future side effects. Current side effects held greater importance than future side effects, in particular in a participant's decision making. However, the medication's ability to reduce the risk of death was deemed more crucial than reducing symptom frequency. Now, these were the results that were found through this study that was conducted by Laba et al. And this study, my dear, was conducted in the year 2012. Now, I have deliberately put the results in points over here so that it not only helps you with better understanding, but this would help you learn in a better manner, in an easier manner too, without losing any important piece of information. Now, one, we spoke about the study that was conducted by Labayol. To remind you all, the study was on rational non-adherence, or the rational decisions that, or the apparently, I'd like to say, rational decisions that are taken by patients when they choose not to adhere. An alternative model over here could be the health belief system as well, that we could use to explain why individuals do not adhere. Now, this health belief model, this is a part of the syllabus when we talk about the first unit or the first chapter, that was patient practitioner relationship as well. So the health belief model states that people's decision about health related behaviors such as delaying seeking treatment are due to their health perception. So we are blaming the perceptions individuals hold about their health. These perceptions individuals hold can be applied to non-adherence as well. So what we're talking about is that the perception that you hold about your health could affect the extent to which you're either adhering or non-adhering to a particular medical advice. Number one, factors that could explain why people do not adhere. Now, there are six factors that we'd be taking into account over here. The first one over here is perceived severity. Perceived severity, or how serious do you think, or how severe do you think the illness or the symptoms are? If someone sees the illness as not very serious, if someone sees their illness as not very serious, they may not stick to the medication as much as for a more severe illness. So, what we're talking about is if you perceive your illness to be severe, you would adhere. If you perceive that your illness is not severe, you will not adhere. One. Number two, perceived susceptibility or perceived risk. People might skip medication if they don't think they're likely to get sick. So when you feel like you're more susceptible, when you feel like you're more vulnerable, when you feel like you're more at risk, the likelihood of you not skipping a medication is higher, right? However, if you feel like the chances or the risk that is involved for you not taking a particular medicine is if you feel like if you perceive that the risk is low, your non-adherence might be high, right? If you feel like the risk is low, you might not adhere to the medical advice. Moving on to the third factor, perceived benefits, or in other words, believing in the treatment. If someone doesn't believe the treatment will work, they may not follow it as prescribed. So, if you're perceiving that the treatment that you've been prescribed might not be the right one for you, might not be the treatment that would benefit you, the likelihood of you not adhering is high. Number four, perceived barriers or the hurdles that you come across. If there are obstacles, like it could be inconvenience in terms of time and effort or discomfort, like inconvenience, cost, or discomfort, people are less likely to stick to the medication. So if it's expensive, you might not adhere. If you experiencing a lot of discomfort, you might not adhere. If you find it super inconvenient, you might not adhere. The fifth point over here is cues to action, or anything that has triggered or anything that has happened that might as well have resulted in you changing your perception about your health or about health in general. So, triggers to action or cues to action. Exposure to something like a loved one passing away from a similar condition can make a person more likely to follow the medication plan. This, I think, is pretty self explanatory. The sixth one over here, self efficacy, or the confidence that you have in you as to the extent to which you'd be able to stick to the prescribed medicine or to stick to the advice that has been given to you by the practitioner. So confidence in following through, people are more likely to stick to the medication if they believe they can handle it and stay on track with the treatment plan, right? If you believe you can handle it and you could stay on track with the treatment plan, the likelihood of you adhering more is always there. So if we just discussed the health belief models, and if I take you back to the syllabus, we just spoke about this first section. We just discussed this first section over here. This is what we covered so far. And of course, if you have and of course, if you know how to write evaluative answers, you might as well start practicing the 10. I'm referring to the 10 mark evaluative answers over here. So this is pretty much it. This is what I had planned to cover today, and I hope this has been helpful. Take good care of yourselves. Stay happy, healthy, safe, and protected. Stay humble. Spread positivity. Spread smiles. And Allah Hafiz.